Antipsychotics. General principles. About 70% of patients with schizophrenia respond to standard antipsychotic drugs, and a further 10% respond to atypical antipsychotics. Antipsychotics also significantly reduce relapse rates. The main mechanism of action of antipsychotics is via blockade of dopamine receptors. The atypicals also act by blocking serotonin receptors in the striatal system and the frontal cortex, hence there are fewer extrapyramidal side effects and greater efficacy for negative symptoms. Antipsychotics can be divided into low potency, high potency and atypical drugs. Low potency drugs, e.g. chlorpromazine, generally associated with more anticholinergic, antihistaminergic, and alpha-adrenergic blocking side effects. Therefore more epileptogenic and cardiotoxic, prolonged QT interval. High-potency drugs, e.g. haloperidol, trifluoperazine, associated with greater extrapyramidal side effects. Atypical drugs, e.g. clozapine, risperidone, olanzapine, quizapine, amisulpride, and aripiprazole. Far fewer side effects, except clozapine. Agranulocytosis is a serious problem with clozapine. Weight gain and sedation can be problematic. Can lead to metabolic syndrome, i.e. hypertension, diabetes, and hyperlipidemia. Indications. The main indication is for psychosis, and use in any other condition, Table 14, must be carefully considered because these drugs have severe side effects that can be permanent, most notably tardive dyskinesia. NB. Use antipsychotics judiciously because of the risk of tardive dyskinesia. NB. Antipsychotics. When using these drugs, remember, always use the lowest dose possible. Start with a low dose and slowly titrate up until therapeutic effect is achieved. Always be aware of side effects. Do not use more than one antipsychotic at a time. Contraindications. Drowsiness, confusion, coma due to central nervous system depressants. Bone marrow suppression. Pheochromocytoma. If at all possible, avoid use in patients who are pregnant or breastfeeding. Complications. Side effects. Side effects to antipsychotics are common, and they can be severe and even life-threatening. Extrapyramidal symptoms, stiffness, tremor, hypersalivation, acute dystonia, akathisia, tardive dyskinesia, tardive dystonia. Anticholinergic symptoms, blurred vision, constipation, urinary retention, dry mouth, confusion, agitation, seizures. Antihistaminic symptoms, sedation. Alpha-adrenergic blockade, orthostatic hypotension. Leukopenia, agranulocytosis can occur with all antipsychotics, but has a high incidence with clozapine. Increased prolactin secretion, amenorrhea, galactorrhea, sexual dysfunction. Metabolic syndrome, weight gain, hypertension, diabetes, hyperlipidemia. Obstructive jaundice with phenothiazines. Allergic dermatitis and photosensitivity. Neuroleptic malignant syndrome, muscle rigidity, hyperthermia, fluctuating level of consciousness and autonomic dysfunction, leukocytosis, elevated creatine phosphokinase. NB. Most important adverse effects of antipsychotics. Agranulocytosis. Neuroleptic malignant syndrome. Acute dystonia. Tardive dyskinesia. Akathisia.